This is the last of our three-part series of lectures on cardiovascular diseases and disorders. The objectives, again, are the same as they have been for the last two sections of the cardiovascular diseases and disorders. In this lesson, we're going to talk about the 5 most common disorders that occur in the heart. So disorders of the cardiovascular system related to that of the heart. So the first one we're going to start with is angina or angina pectoris. Either way is pronounced correctly. It depends on what school of thought you went to and where you happen to grow up. Angina pectoris is what's more commonly known as chest pain. It's caused by a lack of oxygen to the myocardium, heart muscle. Whenever you get a lack of oxygen to a muscle, it causes pain. That's why when you're sitting in your chair for a while, you got to kind of root and move around a little bit because you get sore. You start to experience pain because you're cutting off oxygen supply to the muscles in your buttocks. Well, the same thing can happen to the heart. Arteriosclerosis and spasms of the coronary arteries are probably the most common causes of angina. It can be a sign of impending MI. So it is something that people want to take seriously. To diagnose angina, blood tests are performed to evaluate for atherosclerosis. An EKG may be done to detect any electrical abnormalities of the heart, and cardiac catheterization may be performed to determine the precise cause of the pain. Now, during an attack, the patient may complain of a tightening in the chest or pain that radiates down the left arm or into the jaw. The picture at the lower left part of your screen gives you the common places that people complain of pain when they have angina. Now, angina is treated basically when it occurs. So what we do is when someone has angina, they can take medications that dilate the coronary arteries and therefore increase oxygen to the heart muscle. The most common one for that is nitroglycerin, and it's usually taken sublingually, which is under the tongue. Now, in addition to this, we can also suggest some lifestyle changes that would decrease the person's atherosclerosis and decrease the chance of them having a myocardial infarction. So the next disorder is that of rheumatic heart disease. And rheumatic heart disease is the result of having rheumatic fever. So now what's rheumatic fever? Well, rheumatic fever is caused by a streptococcal infection, such as what you might know as a strep throat. In some cases, the individual antibodies that attack the infection also attacked the tissues of the heart, commonly the heart valves. So you have this strep infection and it begins to attack parts of the heart. More likely than not, it attacks the valves. So what puts you at risk? Well, being exposed to streptococcal infections. So whenever you're around streptococcal infections, you have a chance of developing rheumatic fever followed by rheumatic heart disease. Now, typically, the symptoms of rheumatic fever appear about 2 weeks after the onset of an untreated strep throat infection. So apart from a sore throat caused by the strep infection, you may see a fever and you may see someone who feels ill. Commonly, this happens in children, and the children will have a painful, red, swollen joint. And it's usually a child with a large joint like a knee or an ankle or an elbow or a shoulder that's bothering them. And it's interesting because the pain then goes away after a day or two, but then it gets replaced with the same problem in another joint. So it'll move from joint to joint. You may see some short-lived skin rashes, but that's not all that common. Now, even if the heart is affected by this rheumatic fever, it's typically not severe enough to cause cardiac symptoms, although occasionally we may see a child who's short of breath. Now, in addition, there's a couple of tests that may be used to check the heart and assess any damage, and that would include a chest x-ray, an echocardiogram, or any other variety of imagings that we might use to look at the heart. Now, how do we treat it? Well, first and foremost, antibiotics are prescribed to get rid of the streptococcal infection from the body. Most often, the valve leak caused by the disease is mild and just doesn't need to be treated. However, if the leak is severe enough, then surgery might have to be scheduled to repair the faulty valve. Sometimes the valve is too badly damaged to even repair it, and in which case then we have to replace it with a replacement valve, which can be mechanical or could come from an animal source. Okay, our next disorder is referred to as CHF, or chronic heart failure or congestive heart failure. There's been a push to change the terminology to chronic heart failure because it sort of depicts the disease more accurately than that of congestive heart failure. But you will still frequently hear it called, in most cases, congestive heart failure or just CHF. So heart failure is a condition in which the heart cannot pump enough blood to the rest of the body. Now, as the heart's pumping becomes less effective, the blood begins to back up in other areas of the body. Where does it back up to? For one, it may back up to the lungs, and then fluid can build up in the lungs, may back up to the liver, the GI tract, the arms, and the legs, and in which case you will see any of these or all of these becoming fluid-filled. That's where that thing that's called congestive heart failure comes in. It's that backup of fluid into the other organs as a result of the heart not being able to pump out enough fluid. The most common cause of heart failure is coronary artery disease, which we talked about earlier. High blood pressure that's not well controlled can also contribute to heart failure. So the risk factors for the development of CHF are the same risk factors as those for coronary artery disease. The symptoms of heart failure can begin real slow. At first, they might only occur when someone is very, very, very active. And then over time, they may start noticing breathing problems and other symptoms even as they're resting. So typically it'll start out just when they're very active, and then smaller and smaller increments, it starts to kick in with less and less and less activity. Some of the other things that you may see with heart failure are a cough, fatigue, weakness, feeling faint, loss of appetite, an irregular pulse, shortness of breath, an enlarged liver, swollen feet or ankles, and weight gain because they start holding on to fluid that they should be getting rid of. Now, in addition to the things that we see in a physical exam, a chest x-ray of someone who has chronic heart failure will reveal an enlarged heart, specifically the left ventricle. And an EKG can check for any abnormal rhythms. Another tool we might use is an echocardiogram, that ultrasound of the heart, which will view the movement of the heart and the valves to see how effectively they are or are not getting blood out to the body. The treatment for CHF is aimed at decreasing the workload on the heart. So we will give medications that decrease the amount of fluids in the body, therefore reducing blood volume, therefore reducing work on the heart. We might also give medications to slow down the heart rate and the heart's contractions, strengthen them so that the heart works more effectively. In other words, we make the contractions stronger and longer in duration so that more blood gets ejected out with each contraction and the heart has to work less hard. Okay, our next disorder is carditis. Carditis, if you haven't guessed, is inflammation of the heart. And it can be caused by any infectious organism and is often secondary to another infection in the body, such as a respiratory infection. The most common symptom is chest pain. And then your next question is, have you had a previous infection somewhere in your body? Because that very well may be what's happening. The diagnosis can be tricky for carditis, and really it's based upon the patient's history, physical exam, chest x-ray, and blood cultures. Treatment would include bed rest, pain, and reducing any fever. If a bacterial infection is discovered, then antibiotics would be prescribed. All right, and our last cardiac disorder is that of arrhythmias. Now, A means without, and rhythm refers to rhythm. So arrhythmia would be with a condition of being without rhythm. And we're not talking about my husband here. We are actually talking about the heart. The cause of arrhythmias is usually idiopathic. Many times we don't know what specifically causes them. However, there are some medications, and we also know that a previous heart attack can trigger people to have arrhythmias. Now, arrhythmias, if felt, are usually described by the person as a flutter in their chest, or they feel like they've skipped a beat. When an arrhythmia is suspected, the first thing we do is we perform an EKG. And then this could be followed by something called a stress test, whereby now we have the person exercise while they're doing their EKG and watch their heart response to it. And we might use something called a Holter monitor. And a Holter monitor, Holter, records electrical activity of the heart for an extended period of time. This is really the ideal because you need to kind of catch the heart when it's in action. So someone using one of these devices who's recording their heart rates and their rhythms over a period of time can lead to a very effective diagnosis of arrhythmias. Now, treatment depends on the type and the severity of the rhythm. It may be as simple as just keeping an eye on the patient until things calm down, or it could include medications to help manage the misfiring that's going on in the heart. And with that, we conclude the last of our lecture series on the cardiovascular system.